Canada's healthcare system is in a crisis. Over 6 million Canadians don't have access to a family doctor. We routinely see stories in the news about emergency room situations that are just not acceptable. Patients waiting hours and hours, sometimes dying before they receive the emergency care that they need. But it's not just in emergency rooms where patients are dying. We're seeing patients dying on waiting lists while they wait for surgeries. Everything from cataract surgery, which you're probably not going to die from, but it would affect your quality of life in your final years. And then on the other end of the spectrum, things like patients dying while waiting for procedures like heart operations, where maybe you could save lives if the government provided care in a more timely manner. In fact, some data that secondstreet.org obtained recently looks at Ontario. And what we found is that Ontario health data shows that the number of patients dying while waiting for surgery, it increased by about almost 50% from last year to the year before that. Now, the other aspect that's important is it's not just that patients are dying while waiting for surgery. Some aren't even getting to that stage because they're waiting for diagnostic scans. And when you look at the number of patients who died while waiting for diagnostic scans in the province of Ontario, we see a steady increase going back to 2015-16. Year after year, more and more patients are dying before they even receive the diagnostic scans that they need. So these numbers are obviously very troubling. Today we're going to be talking about other troublesome problems in the healthcare system, bright spots, and other changes that we need to see happen so that we can reverse this crisis that we're in. Today I'm pleased to be joined by Nadim Esmail, who is a senior fellow with the Fraser Institute, and Emmanuel Faubert, who's an economist with the Montreal Economic Institute. Thank you both for joining me today. So I want to start by asking, Nadim, we'll start with you. When it comes to indicators in Canada, in the healthcare system, are there any that suggest to you that the system is in a crisis, or am I wrong when I imply that the system is in a crisis situation right now?
I think the number one indicator of the system being in a crisis is wait times. How long does it take to get access to medically necessary care in Canada? The Fraser Institute has been surveying wait times across Canada for 30 years now, and what we've seen is Canada in 2022 reached a new all-time high of 27.4 weeks from GP referral to treatment by a specialist. That's 3 times as long as the wait time back in 1993 when it was just 9.3 weeks. That's over 6 months from the time you go to a doctor and the doctor says, yep, I think something's wrong with you, time the medically necessary care is delivered. And that wait time breaks down into 2 portions. It's about 13 weeks or 3 months to see a specialist in the first place, to get the secondary diagnosis and more details. Again, just about 3 times the wait time we had 3 decades ago. And it's another 15 weeks then to get treatment. Again, triple the wait time we had back in 1993. These wait times keep increasing year after year after year, in spite of the fact that governments keep making commitments and massive financial injections into the system.
Yeah, no, I'm glad you make that second point because we've looked at the numbers before and government spending has skyrocketed over the past 20, 30 years. It's increased at nearly double the rate of inflation on a per person basis. So more and more money's in the system, but we're not seeing results. And on top of that, I believe you've said in the past that the way that Canada measures wait times, it's not as transparent and accountable as the way that other countries do. Is that correct?
For the official statistics, yes, the Fraser Institute uses a survey-based approach where we speak to physicians directly. But when we look at governmental data, the wait times often appear to be a little bit shorter. But that's because we start the wait times clock at the very last point in the process, the point at which surgery is scheduled or decided upon, which when you look internationally is kind of the latest starting point among developed nations. There is a lot of waiting that occurs before the official government stopwatch begins, including seeing the general practitioner, getting to the specialist, getting through the diagnostic period, diagnostic scanning, as you point out, where people are waiting and expiring, unable to get care, and then again, reassessing, assessing the information, and then finally making the decision. Other nations take far broader approaches to measuring wait times and have a better view of what their healthcare system is doing officially. We do know, though, very clearly that Canadian wait times are among the longest in the developed world, in spite of the fact that we have a very expensive healthcare system relative to what other countries spend on healthcare.
All right, and Emmanuel, when we come back after the break, I want to get your take about what you're seeing in Canada when it comes to the healthcare system, the bright spots and the problem areas. We'll be back with more right after this commercial break.